Thank you for staying with us. There is a popular saying that goes thus: when you fail to plan, you plan to fail. Now, a country without population moderation will not be able to meet up with the economic demands of its people. That's according to the United Nations. More than 40% of women around the world cannot make decisions on sexual and reproductive health and reproductive rights. In Nigeria, the uptake of contraception is low, with a 2021 UNICEF survey indicating that only 4 out of every 10 women use contraception. Now, family planning is an essential component of achieving the Sustainable Development Goal as well as poverty reduction. The modest investment in family planning can save lives and also improve mother and child health. Joining us via Zoom to discuss more benefits is Executive Director, Hazy Health Initiative, Rhoda Robinson. Rhoda, good morning. Compliments of the season. Right. Okay, if you could just switch on your audio or mute yourself, because I can't hear you.
Can you hear me now?
Right, I can hear you now. Great. Now, let's talk about contraceptive. There's so much myth around contraceptive in this part of the world, and so many issues around it. Could you just perhaps educate us on the essence of using contraceptive and demystify the myths around it?
Thank you very much. As you had said earlier, we have a very high unmet need for contraceptive in our country today. Right now, we have over 60% combined unmet need of both sexually active, single and married women who need contraceptives, modern contraceptives, but they do not have access to it. And when we are talking about this need and filling this gap, we're looking at the challenging and addressing the barriers to access, to affordability, to understanding the need for better family planning and the use of contraceptive. A lot of times, most people have both personal and cultural, religious reasons for not using contraceptive, surrounding the myths that prevents women from using contraceptive and for its acceptability in today's society. And when we're looking at this, we're looking at issues regarding the weight, personal health. We're looking at myths when people say that when they use contraceptives, they will not be able to have children when they want. And we're looking at myths surrounding weight gain for women as well. And all this can be addressed properly when there's adequate consultation before the use of contraceptives, because every woman's body is different, as you may know. So the way the contraceptive that is best for us is something that we need to decide, and we need to have the power to decide at the end of the day. So visiting a health facility which is equipped to provide you with the right information to help you make that decision is very vital. Apart from them having that information and being able to give it to you, they also need to have the commodities on ground. That is when you're looking at access to those commodities and the availability of those contraceptives on ground. Nigeria still faces this gap, and we have less than 20% of modern contraceptive penetration right now within the country. So we need to also work on this aspect as well, where we can get the information and where we can get the commodities, so that more women will have access to this, to modern contraceptives in the society.
Yeah, I would love to ask about how these, family planning things, contribute to the economic growth. But then the question Veronica asked is what I would like to build on first, which is the contraceptives of a thing. Nigerians are constantly having to fight against the issue of adulterated products, fake products, because the news is rife now. Someone in our meetings yesterday was like, people are taking contraceptives all in the name that, okay, I'll be protected against having the baby, but the baby is smiling somewhere because you're already taking fake product. So talk to us about the access to these contraceptives and ensuring that what you get is the quality one in order to protect yourselves from having excess, not excess now, but then bearing child when you're not planning to?
Okay, this is where the having the right knowledge about contraceptives come in. There are different kinds of contraceptives, from condoms to birth control pills to implants and IUDs. Now, being able to decide which one to use at every point in time is very crucial in helping you manage your reproduction, or manage pregnancy, or deciding when to get pregnant. There are IUDs and implants that last for 3 years, for 5 years, for 10 years. There are single-use contraceptives such as condoms. There are emergency pills that you can use post sexual activity if you have not been protected, which is highly not advised. So there are different options that you can use, and it is very important that you seek professional advice when using more long-term contraceptives. Than for condoms are easily accessible, but for things like implants, where you have the hormone-based contraception placed in your body, it's important that you go to a health facility and you speak to a healthcare provider to advise you properly on which kind of contraceptives to use. And then when you're going to a facility, there's less of a risk for you buying over-the-counter drugs and medication for contraception, reducing the risk, not entirely eliminating it, but reducing the risk of you buying counterfeited commodities, especially when it comes to contraceptives, so that you don't end up celebrating naming ceremony 9 months before you plan it.
Interesting. But all of this is aimed at fertility control. It is often said that Nigeria is the fertility capital of the world. But then this has been a contentious issue. We recall that sometime in 2004, Nigeria put forward a policy, a national policy on population and sustainable development to control fertility rate, reduce growth rate by 2%. Or less by 2015, but not much was achieved then. And we know how we say that children are a blessing from God in this part of the world, and you see people, want to have more and more of them. We recall even those days, our fathers, have them so they can use them in their farmlands and all of it. Are we having the right conversations with the right stakeholders addressing these matters? Before we even look at contraceptives and for them to embrace them, are we really speaking with the right people? Because when you look at our population right now, it's a whole lot.
Yes, thank you so much. And this brings me back to conversations that we've been having consistently for the last 5 years, when we are looking at investing in demographic dividend, when we are looking at controlling the population boom that is so much closer now than when we were talking about it 5 years ago, and what we've been saying all along. We need to be able to control the number of people that we are giving birth to. And I am not saying this in a way to restrict the rights of people to have children. No, I'm saying this in the fact that people need to understand how population affects economy. Now, when you are earning a certain income, you need to be able to use that income to take care of your family and the number of children that you have. Then in those days, the more children you have, the more people you have working on farms. A lot of us do not work on farms. There are less farms now. And more people are in the community, more people are in our current economy trying to work. There is a shortage of jobs. There is a shortage of resources to take care of the number of people we have in our population right now. Embracing family planning, embracing population control helps in planning for the economy, planning for the future economy. We'll be able to allocate resources better to the population that we would expect. Now, when you're looking at the cultural and the religious beliefs surrounding childbearing, we need to increase engagement with traditional and religious rulers. Over the last year, we've been working hand in hand with the Federal Ministry of Health and the UNFPA in engaging more stakeholders, more partners in the discussions regarding family planning. One of the key aspects is bringing in the private sector into this discussion as well, because apart from pushing out information, we need to ensure that while we are telling people people why it is important for family planning to be embraced, or why they should embrace family planning, we need to ensure that we have the commodities on ground, we have the materials and the information that they need to understand family planning. We have those things on ground. This takes research, this takes development, this takes financing, this takes technology to ensure that everyone has that information. Consistent engagement with religious leaders, with traditional leaders, puts this discussion of family planning and family management in the center of people's life, because when your traditional rulers are talking about it, it's more likely for you to believe them and for you to understand the purpose, because you are not disregarding tradition, but you are showing why it is important for some things to change so that we have a better life for our people. We have a better life for your congregation, or you have a better life for your constituency. So it's an important discussion that not just us in the development sector, us in the government need to start having with them, but leaders in these spaces also need to start having with their people as well, to reinforce the message that we need to plan better for our families.
So I want to know whether this should be a matter of policy, a national policy, looking at what China did. Maybe there is a model we can copy for our own climb. China is known for implementing a one-child policy, which was in effect from 1975 to 2015. And the policy ensured that most of the people in the urban area only have one child. But then it came with its own attendant problems like infanticide, because when people give birth to a female, they wanted male. So they tend to kill the baby while the baby was young, etc., and all of those things. But do you feel that policymakers can strike a balance between personal family planning, promoting family planning as a personal choice, and addressing concerns related to population growth and sustainability?
Yes, policy plays a very key role in all of this discussion, and then you really can't have policy without talking to the people you are making this policy with and addressing their concerns. Well, when China had that policy and they implemented it, it had a lot of pros and cons. But in today's society, I believe we can do better. We can create policies that support people making that decision. We can create policies that ensure that when you have a certain number of children, it is easier for you to take care of them and to understand the benefits of having those and reducing the number of children that you have. So policy in itself, in controlling body autonomy, it's a very dicey discussion that you need to actually have in depth with the people that you are making that policy for. Now, when you're looking at policies that also control or address the information that is available and where that information is available, and policies that support the creation of more commodities or more avenues for people to understand and use family planning, things like that need to be supported as well. We need to have more facilities that have trained healthcare professionals that are able to provide family planning services in effect. So when you're looking at policy and policymakers, they have a very key role to play in building or creating that structures. Right now in Nigeria, we definitely do have those policies. Now, implementing those policies and getting the right kind of funding to implement that policy is an issue that we also have to start discussing as well. And then we cannot ignore the fact that population is also keenly tied to the rights of women, as you said earlier about the issue of femicide and killing of babies and whatnot. It is very important that we are able to balance the rights of women in being able to make that decision as well. Make decision on how many children she can have or she wants to have, and how to space that number of children as well. So this plays hand in hand in ensuring that women have that right, and that right is also protected.
Right. But, ours is a patriarchal society, and there's also the matter of trust deficit. Just recently, we know that the federal government was trying to push the HPV vaccine to protect against the cervical cancer, so to speak, and other issues. But we saw the uproar, how a lot of persons, did not want their children taking their daughters taking this vaccine because of so many stories surrounding it. You are on the field. Talk to us how challenging it is building trust and even the matter of patriarchy standing between the women and they receiving this kinds of help.
Okay, I'll talk a bit about the anti-vaccine protest, or let me say I'll talk about the vaccination, the importance of it first, because a lot of misinformation and disinformation is out there trying to push down the spread, the availability and the acceptability of HPV vaccination. HPV vaccination is extremely important for both sexes. Let me first lay that. But the fact is that women are at a higher disadvantage when it comes to HPV because it has been clearly linked to cervical cancer, which kills a lot of them. One of the top 5 causes of death, cancer that are for women right now. And you'll find that with HPV vaccination given at an earlier age, before sexual debut, even though women who have are sexually active can still take the vaccine, it is most effective before sexual debut, which is why we're promoting it for teenage girls and before girls under 15, because before sexual debut, they have not been exposed to the virus yet. So you can stop that, you can prevent that. And information like this is what people need to understand. They need to understand why the vaccination is important and what it can prevent. This myth around is going to stop your ability to have children in future, is going to make you infertile. These are some of the myths and misinformation that is out there that are preventing people and preventing parents and guardians from allowing their children to get the vaccination. And this is where different stakeholders, the media, creatives, non-profit organizations, NGOs, CBOs, everyone needs to start working together to ensure that the right kind of information is there. And when you're looking at it from the aspects of patriarchy and the rights of women, it is important that we start placing the power to decide in the hands of women, because they are the ones that are most affected by this. When HPV family planning, it rests in the body of the woman most of the time. Yes, it's a joint decision that is made between both sexes. However, when you're looking at what is given up the most, a lot of times women have to sacrifice a lot when having children. It's not a one-day affair that you have sex and then you give birth to a child and then that's it. There's a commitment involved. There are sacrifices on her career development side, on the economic side, on the health side that needs to be considered. And when you're looking at threatened pregnancy as well. So all these things accumulate in how important it is for women to have that right and for the right information to be available for women. Looking at vaccination protests and the misconceptions out there, it is very important to address this. We've been working, HISA has been working hand in hand with a lot of organizations, a lot of creatives to push out the right kind of information when it comes to HPV vaccination, so that a lot of women, a lot of girls have it in time, that 20 years down the line, we are not fighting with cervical cancer that we could have prevented for our kids when we had the chance.
Interesting stuff. I would like you to expatiate on the points you just landed on, which has to do with men and women taking part in this, but then vis-a-vis the issue of the family planning, which we've been talking about. I'm wondering how this contributes to gender equality, talking about family planning, and what efforts are being made to ensure that equal involvement and decision-making for both men and women. Because most times, even when men agree to family planning, they tend to allow only their wives to go ahead and do this. And even sometimes in the narratives, it has always been the female folks doing the family planning. What about the men? Is it something that you feel that if couple decide on going the route of family planning, it should be both of them or just one of them?
Yeah, family planning is a joint effort. For families, for couples who are committed to each other, it is very important to have that discussion between each other, and understanding and reaching an agreement on how many children you have to have, or what kind of contraception should be employed at that point, because it's a joint decision. A woman can be pregnant, and I say this a lot, a woman can be pregnant maximum twice in a year. A man can impregnate more than 500 women in a single year. Yes, so it is very important to have these discussions with men. But unfortunately, when you're looking at family planning options for men, we do not have a lot of bandwidth or a lot of options available. Condoms, vasectomy, the issue of vasectomy is still not extremely accepted within the male populace because the misconception and the permanency of it as well. So it is important that when you have decided the number of children you are going to have and you choose the kind of contraceptive that works for you, when you're looking for a more permanent solution, this should be a joint. I always say, once you've had the number of children that you want, vasectomy is key, because then there is no issue of, oh, there was a mistake somewhere, or something didn't work out, or a woman missed her pills, or things like that. Mm-hmm. This is a joint decision that can be made between both partners as well. So yes, men are very important in the decision because it takes two to tango. So Absolutely. This is why we always emphasize that when you're looking at family planning, have that group discussion. Work without what you want to do, how it's going to affect your family as a whole. Because savings from not having a lot of children means that you can invest more in the education of the ones that you have. You have more free cash to put towards your family's development. You have less spending on healthcare. You have more to invest in education. You have more time to invest in your career growth, in your economic opportunities, in different things for your family, and really support the growth of your family than having to spread limited resources thinly across 7 children, 5 children, 10 children that you would not be able to really give full opportunity. And then you now have a situation where a lot of times maybe only 1 or 2 of all the 7 children you manage to have are able to actually
so don't you think we should be driving conversations around contraceptives for men instead, seeing the impacts it's having on the women and the number of sacrifices she has to make over time with giving birth and sacrificing her career, sacrificing so many things to ensure the stability of the home, that right now we should be focusing our attention on the men and the need for them to understand that perhaps vasectomy is not as bad as they think.
So my point would be, it should not be an instead conversation. It should be an and conversation. Having conversations about family planning and family planning options for women and for men, and the importance of this as a whole, both for the family and for the society as well. So men should understand the options. There are a lot of men out there that do not want their wives on contraceptives, that do not want to use condoms, and these are easily available contraceptive means. So the discussion is not just about vasectomy or who is doing it. It's about the desire and the right to be able to choose to stop having children, or to space or decide the number of children that you want to have, and then coming together as well. The method of contraception should be a joint decision. In instances where it cannot be a joint decision, the woman should have the right to choose what is best for her own self, because at the end of the day, her body is the one that is going through all this, and she has to, by the way our society is currently designed, the woman has to give more. So she should have that right to choose what kind of contraceptive and to actually use contraceptive in the space of her family as well. So it's an and conversation. While you're having conversations with women and trying to push out more contraceptive access and more investment in contraceptive, we should have conversations with men as well on supporting decisions for contraceptive use and for family planning within the society.
I'm wondering how these, impact on the overall public health of people, because the reason why some female folks say they are not doing family planning is because of the side effects, like maybe becoming bigger and all of that. I will speak for the men folk. Sometimes we battle with pot belly. If we go the road of having to do contraceptive, are we not going to be having bulged tummies everywhere?
Sorry, I missed that.
I'm asking if the men folk decide to also, do the contraceptive themselves, are we not going to be having bigger bellies? That's, the pot bellies we're already fighting with. Are we not going to be having bigger ones?
Okay, so let me give you another another side effect of contraceptive. Unsafe abortion is a side effect of not using contraceptive. Ectopic pregnancy is a side effect of not using contraceptive. Threatened and dangerous pregnancy is a side effect of not using contraceptive. So these are more fatal side effects, let me put it that way, than adding a few pounds or being uncomfortable during sexual activity. So when you look at the magnitude of what can go wrong, or in maternal health and in a person and society in itself, and you weigh that to, they say I might gain a few pounds, they say it's not effective, they say it doesn't work well. The scales are not really balanced that well. So we need to look at the overall effects of it. That a lot of unsafe abortions could have been prevented if contraception was available. A lot of pregnancies, dangerous pregnancies for women, could have been stopped if contraceptive discussions and family planning had been had when she had her first, second, or third child. So these are conversations that we need to start having so that we prevent greater and more dire consequences in future. And then this also releases or frees up the strains on our health system as well.
So quickly, there's been also a rise in the use of traditional contraceptives. I wonder how, or what you make of that. Can we bring that into the mix as option for women who feel that the modern ones are perhaps not really working well in their bodies?
So that's yes, we can, because it's very important that's why I emphasize the need to talk to a health professional. There are contraceptives that might not work for you. They might not fit your body system. There are a lot of women contraceptives are hormonal, and women's hormonal balance differ. Like, I've been on contraceptive that did not work, and it's messed up my system as well. So I had to go back and really talk to my healthcare provider about what can work for me, and then decide and choose one that best fits my lifestyle, my body system, looking at how I grow, my activity and all that. So it is best you talk to someone about what works for you. The only contraception that is 100% foolproof is abstinence. Outside of that, you need to be able to pick what works best for you as a person. They are traditional contraceptives. There are myths surrounding traditional contraceptives as well. They are counting based, where you count when your ovulation is. So you need to find one that works for you best.
Okay, we'll leave the conversation here. Rhoda Robinson, Executive Director, Hazy Health Initiative. Thank you for your time on the program.